오직 내 피부를 위한 오리지널 더마 브랜드 세라덤. 여 개국 수출 브랜드. 그 관리, 그 성분. 일명 신데렐라 세럼.
Hello,
I'm Justina Choi, an international team leader of Theraderm.
hello.
Hello. It's nice to meet you. It's a great privilege to have you here at Theraderm Webinar. Thank you very much for your presence with us today. If COVID-19 hadn't happened, FACE Congress will be held as scheduled this week, and we will meet you all in London. It's very peaceful.
That's lovely. I'm already got products. That's the main thing.
Thank you very much. Let's get over the situation. Look forward to meeting you soon in person.
Oh yeah, that will be nice. So I can maybe get products directly from you, because I met Dr. Shamima, who introduced the products to me, and I really like the products. So she was the first one, you know, introduced the products to me, and I'm really pleased with that.
Oh, thank you. Thank you. It's very happy to hear you that kind of good comments. Yeah, and so I hope today you will listen more. It's not so detailed, it's more lovely, because this is the first webinar, and so it's not enough to introduce Theraderm whole program to all of you. But anyway, we would like to introduce our Theraderm program very lovely. But I would like to invite you all to the Theraderm world. And before starting my presentation, I would like to introduce Mr. Michael. Mr. Michael, did you hear me? Hi. Hi, Michael.
Hello, can you hear me now?
Yeah, it's okay.
Hi, good morning, everybody.
Good morning.
Glad to see everybody's safe from the COVID and keeping safe and well.
Yeah.
Hopefully.
Yeah.
Okay, so I'd just like to open. Should we start now?
Yeah.
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 I think there's a short video just for all the people that are listening. My name is Michael Kane. I'm one of the directors of Medical Aesthetics and Wellness, which is part of a global trade group of companies. We are the exclusive distributor of the Theraderm range of products for the UK and Ireland. And we're very pleased to be part of the team, finally. With our medical director, Dr. Shamima Damri, who you all know, we have curated the global aesthetic market to bring innovations in anti-aging medicines and products to the market. The range of peeling system and cosmeceuticals that will now be presented by our highly respected partners and the leading creator of Theraderm would be by Justina and Justine and Jim and Jamie. So we'll do a short Q&A at the end. Over to you in Korea.
Yeah. Okay. Yeah. Now let's start my presentation. Is okay?
Yes. Let's go ahead.
Yeah. Okay.
I'm sorry for interrupting. So during presentation, I'm just gonna off the sounds to everyone so that you can pay attention to Justina's presentation. Thank you for your understanding. Thank you.
Today, let me introduce Theraderm very briefly here in advance. Theraderm is the first unique brand specialized in medical skincare. It established in 1998. Time goes very fast. This year marks the 22nd anniversary for Theraderm. 20 years ago, the concept of medical skincare was very new to Korean dermatologists. To introduce the aesthetic treatment for beauty and health to the doctor's clinic, our founder Young-Mi Kim published the books of medical skincare in series. In her books, she summarized various kinds of therapeutic cosmetic ingredients and also introduced the advanced medical skincare treatment combined with the Theraderm products. Still, these books are used as the textbooks in the aesthetic-related department of universities in Korea. As everybody knows, the skin protective mechanisms are different between white skin and Asians. When peeling therapy from Western countries was first adopted, Korean dermatologists have often experienced many cases of side effects, in particular PIH. Doctors need differentiated peeling programs to treat their patients more safely. Theraderm also need doctors' actual advice to develop optimized clinic program for our market. In the process, Theraderm clinic programs and retail products were observed all these kinds of practical demand and long accumulated experience of doctors. Currently, Theraderm become the very unique medical skincare brand which have supplied the very innovative trendy peeling programs and has supplied to over 3,000 clinics, including university hospitals and big chain clinics in Korea. We started exporting business from 2008 more actively and are exporting to Taiwan, Thailand, Philippines, Indonesia, Vietnam, China, India, Russia, Australia, Turkey, Belgium, UAE, Saudi Arabia, expanding to European countries from starting England. Of course, they are all doctors' market. Now, Korean dermatologists come to be a very much influential and leading dermatology society in the world. As a leader of medical skincare, Theraderm has developed the differentiated professional clinic programs. Doctors can choose the proper treatment to depend on the patient's skin problems. For the acne care, black pill. For the skin pigmentary problems, the Dimella pill. For lifting care, pink pill. For skin rejuvenation, pumpkin pill is recommended. Why Theraderm is different? With the ever-changing technological advances and lifestyle, treatment approach in performing in clinics needed to be constantly updated upon. Strong treatment demanding the downtime did not hold anymore, whether it is laser devices or peeling treatment. Theraderm did not use strong chemical peeling agents. Instead, we peel the skin with a phytochemical acetic acid. Select Korean traditional plant containing the therapeutic ingredients such as red rice, cooked root, and then we made them fermented. The natural acetic acid is obtained together with enzymes, minerals, and other pharmaceuticals during the fermentation process. Thus, when peeling the skin, various natural nutrients penetrate to the skin at the same time. It means that you can do the peeling treatment much safer and effective with the phytochemical acetic acid. Blackberry is the first Theraderm phytochemical peeling program developing focus on acne treatment. This solution is added with potassium iodide, salicylic, and jasmonic acid for strong anti-inflammation and wound healing effect. Black acetic acid is made through the fermented black rice. The peeling effect of Theraderm black pill comes from the black vinegar. In the study by Samsung Hospital, the black acetic acid of Theraderm black pill showed significant depigmentation and also antioxidant effect. After getting the effective proven data for the basic ingredients, we developed the actual products. Theraderm black pill is formulated in two types. One is black clear for light peeling, and the other for deep peeling. When proven products produced, the next process is progressing the clinical test before introducing the market. In case of black pill, 13 acne patients were tested in the Samsung Hospital. As you can see the picture, every patient showed a great improvement. They got the third treatment every 2 weeks interval. Another representative Theraderm phytochemical peeling program is Pink Pill, developing focus on lifting treatment. To make the peeling solution of a lifting pill program, we used cooled. Through the fermentation process, we obtained this cooled acetic acid. Why estrogen pill? Why cooled? When we develop lifting pill, this is because estrogen is the most important factor for beautiful skin. It increases collagen quantity and thus helps to increase skin thickness. But it is not easy to make direct use of estrogen hormone in developing a peeling program because of safety issue. So we needed to look for a similar substance to estrogen. What is phytoestrogen? It is estrogen-like substances produced by plants. What source we use for getting phytoestrogen? Soy and pomegranate are well-known plants that contain phytoestrogen abundantly, but Theraderm's choice was quartz because it contains far more phytoestrogen than soy. As you can see in this list, quartz has almost 30 times greater flavanols, zytosine, and genistein. We did the experiment of cell proliferation of quartz acetic acid because we need to check it did not affect on proliferation on dermal fibroblasts, saying it will not affect on cell growth for cancer. And checked the antioxidant effect. This picture shows the estrogen receptor appearance in the area of applying Pink Pill. Getting the satisfied results with the basic ingredients, we prepared the real product line and started to progress the clinical test. In case of Pink Pill, patients got the treatment every 2 weeks repeatedly, 4 times in Samsung Hospital. As you can see the pictures, every patient showed a lifting improvement, in particular gel line. Clinical study of Pink Pill was submitted to the international journal. The most common cosmetic problem may be pigmentary problems. There have been so many lasers, peelings, cosmeceuticals have been used, but all were not perfect. Most doctors agree that simple and mild peeling treatment is sometimes the best choice for pigmentary problem. Vital C Peel was launched in World Congress Dermatology 2011. It is multi-AHA peeling combined with vitamin C to treat the skin pigmentary problem. To secure the safety from the AHAs, we buffered the pH level up to 3.2. To keep the efficacy, the content of AHAs was increased. It had been a very popular skin whitening program almost over 10 years. The clinical study of Vital C Peel done by Samsung Hospital was published in American SCI Journal in 2012. By the way, as you can imagine, AHA Peel is not enough now. to fortify the effect, Theraderm combined the tranexamine acid and Vital C pill. Tranexamine acid, known as the oral medication, can be more activated and deeper penetrate the skin layers by the powerful delivery boosting of Vital C pill. The clinical case of a study of the Dimela pill has been progressing by Samsung Hospital. It was planned to present a lecture at the Congress of AAD, Academy of American Dermatology. Unfortunately, the study was delayed, and AAD, which would be held last March in Colorado, USA, was canceled because of COVID-19. Fortunately, we heard from Dr. Kim that the study is almost at the end, and it is possible to hold a webinar around this July. Now we are checking the best date. We will invite you, Dr. Kim Won-seok's webinar. Hope that everybody will join with us at the time. So, you heard about Theraderm's clinic program. Not only the differentiated clinic peeling programs, Theraderm has also provided a professional line with ampoules, cream masks, big size cleansers, toners, and serums, and marine mask. Of course, the more important product lines are home care retail. After the peeling progress, even though doctors do everything else right, the patients are using the wrong product at home. It will ruin total process. It is very important for doctors to prescribe the suitable home care products, serums, creams, sunblocks after the clinic treatment. We have set up the retail line perfectly for every skin type. Until just recently, introducing Theraderm's peeling and products, we have troubled everyone with our distributors and key doctors. Pink pill, melasma pill, black pill. Every peeling programs were launched and introduced in the international congress, such as IMCAS Paris, IMCAS Asia, AMWC in Monaco, or WWC, etc. COVID-19 made all relationships stop for the time being. However, time is going by. I believe we will meet soon. Be safe, we survive. And it is time to wrap up my presentation. Now let me introduce Jamie Lee. She is going to give us the presentation with RNM serum. Thank you for listening.
Hello, I am Jamie Lee from Theraderm International team. So I'd like to introduce the new product to all of you. So with Theraderm, newly launched the new impulse serum called Lipoaran. So it is very effective serum for the skin rejuvenation. The concept is very unique and it has a strong antioxidant rejuvenation effect. So you might have a big interest of this product. So I will introduce the main ingredient, alpha-lipoic acid, as well as its own effect. I will show you some before and after pictures as the result of our experiment in the end. You might have a big wonder about the history of Lipoaran. So in Korean clinic, there is a very popular injection called Lipoiron. So it is also well known as the name of Cinderella injection. So because the Lipoiron injection makes the skin feel very firm, rejuvenated, and whitening like a Cinderella. So we were thinking, what if we make the cosmetic for daily use instead of this injection? So we brought this concept to cosmetic. Lipoiron injection contains alpha-lipoic acid, which is a type of vitamin. It has an amazing antioxidant effect equal to 400 times the vitamin C or E. So this powerful ingredient helps the skin whitening and rejuvenating. So the other fact of alpha-lipoic acid is both water and fat soluble, unlike vitamin C or E. That's the reason why it penetrates well into the skin. And when it's applied and acts as a strong antioxidant ingredient. Now you may ask what Lipoiron exactly is. So Lipoiron is alpha-lipoic acid known as thiotic acid. It works as a potent antioxidant, which is an organic compound found in all human cells. Alpha-lipoic acid has a lot of function, but I will mention the main function of alpha-lipoic acid briefly. So first, it is a super powerful antioxidant ingredient. Second, it works as antioxidant battery with recycling. Accordingly, it helps the skin lifted and makes the skin rejuvenated and looking very young. It also has a whitening effect and anti-inflammation effect. Lastly, alpha-lipoic acid is both water and fat soluble, so it penetrates well into the skin. Among antioxidant networking system, alpha-lipoic acid is stronger than vitamin C and E. According to many journals and scientific data, it is proved that alpha-lipoic acid is the powerful antioxidant ever discovered. Alpha-lipoic acid acts as antioxidant battery with recycling network. What it does mean is that, as you can see this picture, it contributes in other antioxidant systems by enhancing the antioxidant effect and work it as a recycling system. It explains that alpha-lipoic acid increases glutathione. The research also proves that alpha-lipoic acid lightens the dark spot and improves the skin appearance of aging skin. It has a protective effect due to anti-inflammation property. Alpha-lipoic acid has both the hydrophilic and lipophilic properties. So this fact is very important. Normally oil and water is separated and never mixed, as you already know. However, with alpha-lipoic acid, it can be mixed because it is both water and fat soluble. So it has the skin penetration effect due to both fat and water soluble properties. It is easily absorbed through the lipid layer of the skin and works well as a free radical fighter in the cell plasma membrane. I need to mention another powerful ingredient, TX, which is the tranexamic acid. Apart from alpha-lipoic acid, it contains TX. We put TX into our Demella peeling program for treating melasma. So as some of you might know, tranexamic acid can be used by oral, intra-injection, or topical application. It reduces melanin synthesis and has been proved it works well to treat melasma. So far, we've known the effect of the main ingredient, alpha-lipoic acid, and we understand why it is the good ingredient for the skin rejuvenation, lifting, and antioxidant, etc. So it is time to get to know our product more deeply. So this product has two separate parts, which are ample part in red and the serum in transparent color on the top. So before showing the direction, I would highlight of the main effect of this product. So we've proved those effects through experiments and case studies. So it showed 800% improvement in the dark melasma and brown spot, and 300% improvement in the pigments and melanin, 100% improvement in the skin elasticity, and 100% improvement of skin smoothness. We got the certificate of patent for the Lipoiron Cinderella Liporan Cinderella cosmetic version. So we developed a very unique concept using alpha-lipoic acid. Following our unique brand concept, medical skincare, the concept that we brought the idea of injection have been used in clinic to the cosmetic is very special, unique. You can feel the difference than any other Empress serum of another brand. The main ingredient of ample pot is obviously alpha-lipoic acid. And on top of that, we've got so many good ingredients inside the serum pot. So as a water-pellic antioxidant network, we have ascorbic acid and glutathione. As lipophilic antioxidant network, we've got tocopherol acetate, ubiquinone, and retinol. So for skin volume effect, we have sodium hyaluronate and hydrolyzed elastin and hyaluronic acid. So for NMF, we have urea. And for whitening effect, we put tranexamic acid and niacinamide. And for anti-wrinkle effect, we have adenosine. Those are effects proven in experimental studies. I'm going to mention again to highlight the effect of our product. So it has immediate wrinkle reduce effect and immediate whitening effect. And it has lifting and skin elasticity. And it has moisturizing in deep skin pot. And it has immediate skin radiance and brighten skin tones. It has got volume up and plumping effect. And it also diminishes melanin and spots. So I'm going to explain how to use of this product. When you use this, you can just turn the bottom pot to the end of right direction. Then the red liporan ampoule will come out to the surface. After, you can just shake the bottle enough to mix well. And you apply on your face with 2 or 3 pumping. That's enough. And if possible, you can apply this as Empress serum directly on your face. So we've done so many experiments to study, as you can see, and another so many studies done. So you're wondering if it is really effective. So we've done so many case studies to prove the effect of the Liporan Empress serum. So please see the picture on the left. Before using Liporan Empress serum, the 51-year-old lady has dark melasma on the cheek. And we direct her to apply this Empress serum for 10 days in the morning and in the night. So 10 days later, you can see the result on the right side picture. The melasma is slightly gone and her skin look very rejuvenated. As you know, treating melasma is very, very hard, even with laser treatment. But we wanted to prove that the patient can get best result with only cosmetics. Those are the results of our other case studies with different patients. Both ladies got the good result after using this serum. Severe dark melasma has been lightened 4 weeks later. We've done studies with 21 female. After 10 days, the improvement percent increased up to 5.63%, and 4 weeks later, it increased up to 6.29%. We've experimented regarding improvement in melasma as well as melanin under skin surface. After 4 weeks, you can see the improvement in melasma and melanin. Also, this case study shows that 4 weeks later, the skin density is increased a lot. So we've done experiment regarding skin density and tightening. As you can see, after 4 weeks, skin density is increased up to 12%, and even with only one-time application, it increased up to 6%. Sorry. So it also has shown there was 200% improvement in depth of nasal labia and 100% improvement in facial lifting, especially cheek part. the experiment also has been proved that leucovorin and perserum has increase of elastin and increase of type 1 collagen. After applying leucovorin and perserum, you can see also immediate improvement in even skin tone. It's a result even with only one-time application. You can also see increasement in even skin tone improvement, and also it is also very effective to make pore very small and make even texture. Thanks for listening and joining with us. We really appreciate your participation. As Justina said, we look forward to seeing all of you again in Dr. Kim's webinar around July. So before ending this webinar, Mr. Michael Kane will give a brief closing comment. Thank you very much. So I'm just gonna open the microphone to only Michael.
Hi.
Hi,
Thank
Michael.
you.
Yeah.
Hi. Thank you very much for the presentation. We're very grateful, and this seems to be the new medium to do business and to gain information in the short term. And I'd like to thank the participants for coming. If any of the participants that partake of this would like to have any questions, if you can email them to us, or to Dr. Shamima, we will then pass them on to Theraderm and get you an answer in probably the next sort of week or so. And I'd just again like to reiterate our thanks to Justina and Jamie for their presentation, and we look forward to the end of the COVID. Stay safe, and hope that we can see you all so shortly. Thank you.
Thank you very much, Michael. I'm just gonna end this Theraderm first webinar. Yeah, if you have any question, please send it to Michael or Dr. Downey. Thank you very much. Enjoy your rest of the day. Bye.
Bye-bye. Thank you. Bye-bye.
Thank you.